physician. I trained at NUI Galway, but about 7 years after I completed my postgraduate training in radiology, I did an MBA at Columbia. And it really was a game changer for me in terms of giving me the tools and the skills that I needed to be a healthcare leader, to be at the table talking about balance sheets and negotiating. So because it was such a pivotal thing for me in my career, I really wanted to offer that opportunity to another woman. Obviously, as physicians, our primary obligation is to the individual patients we serve, but when we design health systems, I think it's really important for physicians to be at the table doing that work. And when we don't have the skills like finance, like negotiations, we can perhaps feel a little intimidated. Add to that there's a dearth of women in leadership, and healthcare is no different. So really wanting to equip women physicians so that we can close that gap, but also just bring more physicians to the leadership table in healthcare. This is absolutely a scholarship for women, and I've been really inspired by the work and journeys of pioneering women in medicine in the late 19th, early 20th century. And those women faced structural barriers far higher than anything I've ever faced. But they were very focused once they reached their goals of turning back and helping other women to achieve their goals. So that's been inspiring to me. And in terms of what I would say to someone thinking about applying, it's that with an MBA in hand, obviously I have my medical training and my medical expertise, but the tools and skills that I learned in my MBA mean that nobody ever puts something in front of me in a meeting that scares me. I think about decisions differently. Sometimes as physicians we're taught that we're the only ones who have the answer. Business school teaches you to work in teams and teaches you to understand what each person brings to the team. So I would say that it gives you a different skill set and one that will give you confidence to pursue leadership.